Hey everyone, welcome back to my channel. This is Dr. Garima. If you're new here, subscribe to the channel. And this is series of 28th notebook and this is part 5. So let's get started. Current toxicity is protamine sulfate. Hepatitis B, drug of choice tenofovir with hepatitis D, interferon alpha. Hepatitis C, direct acting antivirals, sofosbuvir and veltepasivir. Next, hepatic cell carcinoma, sarafanib and nivolumab. Next, one-liners about the irinotecan. This is topoisomerase inhibitor, act as S-phase. Treatment for colon cancer, pancreatic cancer, gemcitabine resistance, and side effect diarrhea. Treatment loperamide. Contraindicated in Crigler-Nazar syndrome. Next, disease is HSV. Drug of choice valcyclovir or acyclovir. Resistance Fescarnet. Next is the Haemophilus influenza, meningitis, ceftriaxone is a drug of choice, respiratory and otitis, ampicillin and sulbactam, prophylaxis rifampicin, HOCM drug of choice propranolol, Hodgkin's lymphoma drug of choice ABVD, and hookworm drug of choice albendazole. Next drug is etoposide, topoisomerase 2 inhibitor, treatment for testicular cancer, prostate cancer, small cell cancer lung. And the next disease is Huntington's chorea. Drug of choice tetrabenazine. For the severe typical antipsychotic haloperidol. Next is the H-nana. Drug of choice praziquantel, then niclosamide. Hypercalcemia of malignancy. Drug of choice zoledronate. Zoledronate also give for Paget's disease. Next is the hypercholesterolemia. Drug of choice statins, rosuvastatin in the pregnancy and child cholestyramine. Next is the hyperlipoproteinemia. Drug of choice statins, fibrates, hydroxyurea. This is the recent question. Next is the hyperprolactinemia. Drug of choice cabergoline. Planning to get pregnant, you can give bromocriptine. Next is the hypertriglyceridemia. Drug of choice fibrates. ADE fibrates is gallstones and bile acid binding resins increase TG, triglyceride. Next disease is hyperthyroidism. Drug of choice methimazole, then propylthiouracil. Hypothyroidism, drug of choice levothyroxine. Next is the hyperthyroidism, drug of choice levothyroxine. Hypotension, spinal anesthesia, phenylephrine, then ephedrine. For the shock, norepinephrine and orthostatic midoprine. Next is the asparaginase, given IV, selective lymphocytic toxicity, treat acute lymphocytic leukemia, ADR hypersensitivity. Next is the hypertension. If it is less than 55, ACE inhibitors and ARBs. If the patient is more than 55 years, calcium channel blocker. For the resistant hypertension, spironolactone. For the diabetes, CKD, nephrotic and scleroderma, ACE inhibitors and ARBs. Angina, MI, migraine, beta blockers. Anxiety, AF and hyperthyroidism, beta blockers. Raynaud's, CCB, calcium channel blockers. Osteoporosis, thiazides, BPH, dyslipidemia, alpha 1 blockers. Hypertensive emergency nicardipine, hypertensive urgency clonidine, pregnancy labetalol. Gemcitabine, CA pancreas, drug of choice folfirinox. It is general resistant. Next is the ITP, drug of choice dexamethasone, then prednisone. Next is influenza, drug of choice oseltamivir, and then inhaled zamavir. Next, insomnia, zalpelone, sleep induction. Next disease is insulinoma, drug of choice diazoxide and octreotide. Iron toxicity, drug of choice desferrioxamine. IBS, constipation, PEG, osmotic. New drugs, lubiprostone, type 2 chloride channel, lanaclotide, guanyl cyclase. For the diarrhea, loperamide and allosterone. Allosterone is a 5-HT3 inhibitor. Only female approved, can cause ischemic colitis. Next is the isosporiasis, drug of choice cotrimoxazole, cipro and nitazoxanide. Zetlag, zalpelone, then ramelteone. Kala-azar, visceral leishmaniasis, liposomal amphotericin B and meltifosine. Kaposis sarcoma, doxorubicin, daunorubicin, IFN alpha. Kerioin, graciofulvin exclusively in microsporum. Graciofulvin is a drug of choice in trichophyton. Terbinafine also drug of choice for trichophyton. Next is the Klebsiella, drug of choice ceftriaxone, Legionella, drug of choice azithro, levofloxacin, doxycycline, leptosporiasis, drug of choice penicillin, doxy and azithro, Listeria meningitis, drug of choice ampicillin. Next is the nitrosoureas, carmostine or lomustine, used to treat brain tumors, now drug of choice for temozolomide, ADR sustained neutropenia. Next is the leverhulk, drug of choice for the fasciola, triclabendazole and the clonorchis praziquantel. Loa Loa, ivermectin and DEC. CA lung, cisplatin for the lung fluke, drug of choice praziquantel. For the LGV, drug of choice doxycycline, then azithro. Next drug is the rituximab. It is anti-CD20 treatment for NHL, FCR or CHOPR. For the CLL, FCR, Kaposi sarcoma, rheumatoid arthritis, and ITP. Next is the malaria, severe falciparum, drug of choice IV artesunate for the 48 hours. In the case of Vivax and Ovel, drug of choice chloroquine for the 3 days and primaquine for the 14 days. Next is the falciparum, chloroquine resistance, Armether plus lumefantrine, and the artesunate plus PYRE, praziquantel. For the pregnant, drug of choice chloroquine. For the prophylaxis less than 6-week travel, doxycycline 100 mg OD and the more than 6 weeks 250 mg mefloquine. For the vaccine is the Mosquirix RTS AS01. Next is the D-actinomycin treatment for choriocarcinoma, Wilms tumor. ADR is the radiation recall syndrome for the doxo and the daunorubicin. Next disease is malignant hyperthermia. Drug of choice dantrolene. Next is the melanoma. This is the recent question. Drug of choice vemurafenib and daborafenib in the case of BRAF positive and pembrolizumab and nivolumab BRAF negative case. And then nivolumab is the DDI inhibitor. Next is the mania, oral lithium, and in the case of acute we can use valproate, then atypical antipsychotics. Next is the melodiosis. Drug of choice ceftazidime. Meningococcal meningitis. Drug of choice ceftriaxone and the ciprofloxacin for the prophylaxis. Next is the fludarabine. This is the recent question. Treatment for CLL and NHL. ADR is the pulmonary interstitial pneumonitis. Next is the meningitis. Empirical is the ceftriaxone. Mesothelioma, drug of choice pemetrexed plus cisplatin plus bevacizumab, which is VEGP inhibitor. Methanol poisoning, fomepizole. Next disease is microsporidiosis, drug of choice albendazole. In the case of migraine, triptans, prophylaxis propranolol, and the topiramate. Next drug is the azacitidine or decitabine. Mechanism of action is the demethylation of DNA, and the treatment is myelodysplasia. Next is the Moraxella. In the case of Moraxella, drug of choice ciprofloxacin is the most active drug. This is the recent question. For the morning sickness, drug of choice doxylamine plus pyridoxine. This is the recent question. Morning motion sickness, drug of choice scopolamine. 4 to 6 hours before travel and antihistamine before 1 hour. MRSA, methicillin resistant Staphylococcus aureus, drug of choice vancomycin. You can use linezolid, streptogramine, and the tigecycline. Next is the mucormycosis, drug of choice liposomal amphotericin B and posaconazole. New one is the isavuconazole. Next drug is the doxorubicin, which used in the case of Hodgkin's lymphoma and the osteosarcoma. It causes cardiotoxicity. In the case of cardiotoxicity, we can use trastuzumab. It increased dose of the cyclophosphamide. Next disease is the multiple myeloma. Drug of choice bortezomib plus lenalidomide plus dexa. Multiple sclerosis. In the case of acute attack, IV methylprednisolone, RRMS, interferon beta, SPMS, interferon beta, PRMS, mitoxantrone, and a PPMS, ocrelizumab, anti-CD20. Next is the muscle relaxant for the intubation is succinylcholine. Myasthenia gravis, drug of choice pyridostigmine. Myasthenia crisis, drug of choice IV immunoglobulin, and then plasmapheresis. MAC, drug of choice, rifampicin, ethambutol plus aminoglycoside plus clarithromycin. Next is the mycoplasma. In the Mycoplasma hominis plus ureaplasma, drug of choice doxycycline, and Mycoplasma pneumoniae, drug of choice azithromycin. Myelodysplasia, drug of choice azacitidine and decitabine. Next is the myelofibrosis, hydroxyurea, and necroanalysis. Drug of choice thiopentone. Next is the ustekinumab. Mechanism of action, it inhibits IL-12 and IL-23. It is used in the psoriasis. Next is the narcolepsy, drug of choice modafinil and solriamfetol, which is DNRI. Reversal of NDMR, drug of choice neostigmine, nephrotic syndrome, MCD steroids, cyclosporine, and EP cyclophosphamide. Neuroblastoma, drug of choice cyclophosphamide, doxorubicin, etoposide. Next and the last one of drug of choice, tocilizumab, mechanism of action, it inhibits IL-6. Treatment for COVID, rheumatoid arthritis, TTA, GCA, it increases risk of melanoma infections. Next are the PSM formulas. ये करना है या नहीं करना, let me know in the comment box. I will skip that part. Let's go to the next part. अगर करना है तो let me know in the comment box. I will make another video. Next part is all normal lab values. Common lab values: CBC, blood collected in EDTA tube, lavender and purple color. Normal value of TLC is 4,000 to 11,000. In the infants, 1 year 6,000 to 16,000, at birth 10,000 to 25,000, and in pregnancy 12,000 to 20,000. Next is the HB. Normal HB in the male 13 to 17 and in female 12 to 15, and am anemic. RBC 4.5 to 6.5 in males, 3.8 to 5.8 in females. PCV normal value 40 to 54% in men and 37 to 47% in female. MCV 80 to 100, MCH 0.4 to 0.5, MCHC 30 to 35, normal reticulocyte count 0.8 to 1.5%. Next one is the red cell distribution width 11.5 to 14.5 is the normal. Neutrophils 40 to 75%, lymphocytes 20 to 50%, eosinophils 1 to 6%, basophils 0 to 1%, monocytes 2 to 8%. ESR is in the male 0 to 9 and in the female 0 to 20. In the case of Wintrop's method, you can use the formula. ESR 0 to 15 in men and 0 to 20 in female. Next is the CRP 0 to 3 gram per deciliter. Next is the LFT, liver function test. We collect blood in the red test tube. Normal value of SGOT or AST less than 40 units, 12 to 38. SGPT or ALT more than 40 units, 7 to 41. Total bilirubin 0.3 to 1.3 milligram per deciliter. Direct bilirubin 0.1 to 0.4 milligram per deciliter. Serum total protein 6.7 to 8.6 per deciliter. Serum albumin 3.5 to 5.5 ग्राम पर डेसीलीटर. अगर आपको और लैब वैल्यूज करनी है, आई ऑलरेडी अपलोडेड द वीडियो. आई विल गिव लिंक इन द लास्ट ऑफ दिस वीडियो. Serum alkyl phosphate 30 to 120 in the adults and less than 350 in child. Gamma glutyl trans 0 to 40. RFT also collected in the red test tube. Urea 20 to 40 or 2.5 to 6.5 millimole per liter. BUN 7 to 20 milligram per deciliter. Serum creatinine 0.6 to 1.36 or 60 to 120 millimole per liter. Serum uric acid 3.1 to 7 milligram and 2.5 to 5.6 milligram in females. Next is the serum electrolytes collect blood in red test tube. Sodium 136 to 145 millimole or milli equivalent. Potassium 3.5 to 5.5, calcium 8.5 to 10.5, PO4 2.5 to 4.5, magnesium 1.5 to 2, and chloride 95 to 105 milliequivalent. Next is the lipid profile. Collect blood in the red test tube. Should be done in fasting. Total cholesterol 150 to 200, borderline 200 to 239, high is the more than 240. Triglycerides 50 to 160 milligram, HDL 40 to 69, LDL 80 to 160, desirable less than 130, borderline 10 to 159, and high is more than 160 milligram. Next one is the coagulation screening. Blood should be collected in blue test tube. Normal bleeding time 2 to 7 minutes. Normal clotting time 4 to 9 minutes. Prothrombin time 12 to 15 seconds. APTT 28 to 31 seconds. INR 1. Blood sugar monitoring, collect blood in the gray test tube. HbA1c 4 to 6%, assess the average blood glucose level for the last 2 to 3 months. Fasting blood sugar normal 70 to 100 milligram per deciliter. Then 126 if it is diabetes mellitus. PPBS normal 140 milligram per deciliter in the diabetes more than 200. RBS diabetes more than 200 and other. Serum amylase 20 to 96. Serum lipase 0 to 160. Vitamin B12 140 to 980. Rheumatoid factor less than 30. Serum ferritin 30 to 250 nanogram per ml, males 10 to 150, females. Prolactin 2 to 20 in males, 2 to 30 in females, and 10 to 209 in pregnant women. LDH 208 to 460. Next are the plasma proteins: albumin 3.5 to 5.5, globulin 2 to 3.5, fibrinogen zero point 0.2 to zero point 0.4 gram per deciliter, and Ag, albumin globulin 1.5 to 3.1. Next is the TFT. T4 5.4 to 11.7 or 70 to 151. T3 70 to 151 nanogram per deciliter or 1.2 to 2.1 nanomole per liter. TSH zero point 4 to 5, zero point 4 to 5. FT3 1.4 to 4.2 and FT4 or thyroxine zero point 9 to 2 nanogram per deciliter. Next is the URE, urine routine examination. pH is 5 to 9. Protein excretion in the 24 hours less than 150 mg per day. Red cell 0 to 2. Microalbumin 24 hours 0 to 30 mg. Epithelial cells 0 to 2 and pus cells 0 to 5. Cast in urine. Hyaline cast seen in dehydration, strenuous exercise. Granular cast seen in CKD, strenuous exercise. RBC cast always pathological, glomerulonephritis and vasculitis. WBC cast in the inflammation and infection. Next are the vacutainer tubes. रेड कलर नो एंटीकोगुलेंट, कोई एंटीकोगुलेंट नहीं होता है इसमें. यूज इन LFT, RFT, सीरम इलेक्ट्रोलाइट, लिपिड प्रोफाइल. नेक्स्ट इज द ग्रे. ग्रे में क्या होता है? सोडियम फ्लोराइड, ग्लूकोज एस्टिमेशन करते हैं इसमें. नेक्स्ट इज द पर्पल, EDTA, CBC, ESR, CRP करते हैं. नेक्स्ट इज द स्काई और ब्लू, 3.2 to sodium citrate coagulation studies like PT, APTT. Next is the green for the heparin bone marrow studies. Next is the yellow, citrate blood culture. Pink, K2 EDTA, blood bank test, blood typing, ABO grouping, etc. We use pink vacutainer. Next is the stool examination. Next is the coproporphyrin 400 to 1000 milligram per day. Fecal fat excretion less than 6 per day. Occult blood negative less than 2 ml blood per day. Urobilinogen 40 to 280 milligram per day. Next is the analysis of the ABG. For the bicarbonate, नॉर्मल वैल्यू 21 to 29, कहीं कहीं 26 भी दिया हुआ है, मैंने 26 ही लर्न की हुई है. हाइड्रोजन आयन 37 to 45, PaCO2 4.5 to 6.0, PaO2 12 to 15 kilopascal. Oxygen saturation more than 97%. CSF analysis. Opening pressure 90 to 180 H2O. Appearance and color clear, colorless. Blood count WBC less than 5, RBC less than 5. Glucose normal value in CSF 50 to 80 milligram per deciliter or more than 60% of blood level. Protein 15 to 60 mg per deciliter or less than 0.45 gram per deciliter. Oligoclonal bands is negative. Next part is the named signs. Aaron's sign, a sensation of pain or distress in the epigastric or precordial region on pressure over the McBurney's point in appendicitis. Abad's sign, Charlie Abad's spasm of levator palpebral superioris muscle, a sign of Graves' disease. Jane Abade, insensibility of Achilles tendon to pressure seen in Caves dorsalis. Air cushion sign, Synonym is Klim's sign. In the radiograph of chronic appendicitis, there is often an indication of tympanitis in the right lower quadrant. Adder's sign of shifting tenderness. This sign is useful to diagnose acute appendicitis in pregnancy. Locate the most tender spot and mark it on the skin. Now request the patient to turn on the left side and wait for a full minute. If the tenderness is of uterine origin, it will shift with the uterus while the position remain constant in case of appendicular origin. Next is the angel's sign or angle sign, helpful in the diagnosing of the torsion testis due to development anomaly. The presence of mesentery between the testis and the epididymis is invariably bilateral. The sign is usually obscured on the affected side and can be made out by examining the patient in the standing position, wherein the opposite testis will be found to lie horizontally instead of the normal vertical position. Next is the Anghalascus sign, seen in post-disease of spine, TB spine, wherein the victim is unable to bend the spine while lying on the back so as to rest on the head and heel alone. Argyll-Robertson pupil sign, typically described for neutrosyphilis, wherein light reflex is lost while accommodation reflex is retained. Such an eye responds poorly to mydriatics. This is due to destruction of the fibers between pretectal nucleus and Edinger-Westphal nucleus. Other conditions where this sign may be seen encephalitis, vascular and traumatic lesions, cerebral tumors, diabetes mellitus, and the chronic alcoholism. Auenbrugger's sign, bulging of the epigastrium due to the massive pericardial effusion. This sign highlights the importance of the examining thorax in patients with abdominal symptoms. Next is the Babinski's sign. Loss or weakening of the Achilles tendon reflex in sciatica. This helps distinguish true sciatica from hysterical sciatica. In hemiplegia, the contraction of the platysma muscle in the healthy side is more pronounced than on the affected side. It can be elicited by asking the patient to open the mouth, whistling or blowing, etc. When a hemiplegic patient is lying with arms crossed upon the chest and makes an effort to sit up, the thigh on the paralyzed side is flexed upon the pelvis and the heel lifted from the floor, while lip on the heel healthier side does not move. When the paralyzed forearm is placed in supination, it turns over to pronation. It is seen in organic paralysis and is also called pronation sign. Next is the Bade sign, described for pseudocyst of pancreas and is well appreciated in thin individuals. When Ryle's tube is passed into the stomach, it may be palpated over the swelling because the stomach is displaced anteriorly by the pseudocyst pancreas. Next is the balances sign, seen in about 25% of the ruptured spleen. This is a dull note in both the flanks due to hemoperitonine. The dullness on the right side can be made to shift, but that on the left side remains constant fixed because the blood in the vicinity of the ruptured spleen gets coagulated soon. Next is the Ballet sign. This sign is helpful in Graves' disease and hysteria, wherein there will be persistence of involuntary pupillary and reflex eye movements with the loss of all voluntary eye movements, external ophthalmoplegia. Next is the Bamberger's sign. A sign described in pericardial effusion, presence of signs of consolidation at the angle of scapula, which disappears when the patient leans forwards. Banana sign, an ultrasonographic sign described for Arnold-Chiari malformation or deformity, a cause for congenital hydrocephalus. Sonography of the fetal skull reveals flattened and curved banana-like shape of the cerebellar hemisphere. Bastard's sign, a sign described in a case of appendicitis, mentioned to be condemned when colon is inflamed with air through a rectal tube. Pain and tenderness can be elicited in the right iliac fossa in a suspected case of appendicitis. Such maneuver carries risk of perforation and hence should not be entertained. Next is the battle sign. It is relevant in middle cranial fossa fracture, bruising, ecchymosis over the mastoid process in the line of posterior auricular artery is a telltale sign of underlying middle cranial fossa rupture, temporal bone fracture. Bergman's sign, a urological radiographic sign. The ureter is dilated immediately below an obstructing neoplasm rather than the collapse as seen in the cases of obstructing stones. The urethral catheter passed in such cases tends to coil in the dilated portion of the ureter. Barry's sign, indicated by the absence of carotid artery pulsation in presenting with goiter swelling, is an ominous sign of thyroid malignancy due to carotid shed infiltration by the malignant issue. Basalt sign, described in a case of mastoiditis, an inflammatory swelling seen below the apex of the mastoid process. Next is the Baderman sign. A dark color instead of normal pink color of the anterior pillar of the throat is seen in some patients with syphilis. Next, bird sign, described for hydrated cyst of lung wherein a definite zone of dullness with absence of the respiratory sounds may be appreciated. Beard neck is sign, analgesia of ulnar nerve in general paresis and tapes dorsalis. Next is the Blatine sign. Synonym is the hydrated thrill. A sign elicited in cases of hydrated cyst disease. It is due to displacement of daughter cysts in the fluid of the mother cyst. Next is the Boas sign, an area of hyperesthesia posteriorly extending 2.5 centimeter lateral to the spinous process of the vertebra, to the posterior axillary line, and vertically from the level of the 11th dorsal to the first lumbar spine, a definitive sign of the presence of the cholecystitis. Next is the Blumberg sign. Synonym is the rebound tenderness release sign. It is a sign of peritonitis due to presence of an inflamed organ underneath it. Bonnet sign, pain on thigh, adduction and sciatica. Boston sign, synonym is the von Graves sign. It constitutes the lid-like elicited in case of thyrotoxicasis. इफ यू वांट दिस पीडीएफ आप मेरा ग्रुप ज्वाइन करो टेलीग्राम पे मिस मेडिसिन यूट्यूबर के नाम से है आप सर्च कर सकते हो और ज्वाइन कर सकते हो and I will give link in the description box. Do share the video to the needy one. Don't forget to subscribe to the channel. Part 6 will come soon.